They're concerned about the death toll from the klebsiella outbreak at the facility, citing poor management of the hospital. The overcrowding has been blamed for the outbreak that's claimed the lives of at least 6 babies. eNCA's Masego Rahlaga is following that story. She's outside the hospital for us this morning. Masego, very good morning to you. Can you tell us why the hospital workers are actually marching over this issue this morning?
Good morning, Uveka. Well, remember last month there was a march at the hospital by the nurses who had said that it was 6 babies who had passed away then, and the department came back to say that it was 2. The nurses had actually abandoned their posts. But what we found out this morning is that actually it's the community members of Vosloorus who've asked the nurses that they join them in marching against what they say is the death toll at the hospital, saying that people are actually dying unnecessarily. The community is saying it's not only the klebsiella outbreak that's causing these deaths, or rather that people are dying from. They're also saying that sometimes there's not enough equipment. Sometimes they are told that they cannot perform some things that are performed in theatre because there's some equipment that's missing and nurses can't do it. And sometimes people have to spend a long time in the queues because the nurses say they are short-staffed and there's so many people who need the services at the hospital. So this morning, it's not just the hospital staff, Uveka, it's actually also the community which says it's tired about the fact that people are dying in large numbers at this hospital.
Because we had Health MEC Gwen in here earlier this morning, Masego, and she seems to think that they have things under control now at this hospital. They're investigating the cause of this outbreak, and it seems this is not a very old hospital also, and that, you know, they are moving the affected babies to 2 other hospitals as well to deal with this. So what you're telling us seems to be a very different story to what we actually heard this morning.
Yeah, and I mean, of course, the Health MEC will say that they have things under control. They have to try all they can to make sure that, no more babies will be passing away from this outbreak. But at the same time, the community is saying that it's too late. Why do they have to, for instance, last month, with nurses downing tools, or rather abandoning their posts, why does it have to get that far for government to hear them? One of the nurses actually that I spoke to last month, Uveka, after the 2 babies passed away, had said that they sometimes are short of simple things such as the sanitizer for their hands, or tissue to wipe their hands, or gloves, for instance. And that means that they cannot perform their duties properly. And of course, you can imagine if a nurse doesn't have gloves or the sanitizer that is used to actually make sure that their hands are clean before they perform the duties, what danger it poses on the patients that are being treated. But of course, we'll be finding out from the community themselves today, and that should be interesting, when they join the march, what exactly it is that they are complaining about, because they say for the fact that this is the only public hospital that they can use, because remember, the old Natal Spruit hospital was closed and this was built, and all the staff from there moved here. And as you said, Uveka, it is a very new hospital, and the community feels as though, with the amount of people that the hospital services, not only Vosloorus but many other areas around Vosloorus, they feel that the hospital is not adequate. The staff is not able to do what they should, and also the staff themselves saying they're actually short-staffed. For instance, sometimes they say that sometimes they have to, 5 of them have to look after 96 neonates, for instance, and the law says nurses it's supposed to be 1 to 5. The ratio is supposed to be 1 nurse to 5 patients. So can you imagine 5 nurses looking after 96 patients? That's more than doubling the amount of work that they're supposed to do.
Now, Masego, our understanding was that the affected babies, or the dealing with the klebsiella outbreak, would mean moving these babies, and I'm sure that process is still underway. Do we expect that this march or this strike at the moment is going to affect that relocation of these babies?
Well, what the community and the nurses did promise, Uveka, is that they wouldn't disturb any services to patients that need to be seen today. They will march, of course, and they want to be heard, but they will not disturb anything inside. And of course, Uveka, like you said, the health minister saying that Gauteng actually needs 6 more hospitals. There is overcrowding. He said it's 132% overcrowding in all Gauteng hospitals, not only the Thelle Mogoerane hospital. And of course, also saying that they've moved some of these patients, specifically the neonates, they've moved them to hospitals such as the Charlotte Maxeke Academic Hospital, where they are expected to be looked after better. He also said that he's worried about the way that this hospital is actually structured. He said that actually also makes the outbreak worse. It makes it spread even more. So of course, the nurses saying they will not disturb any processes here. Those nurses who are supposed to be on duty, hopefully a skeletal form of staff at least, will be around to look after those patients. But most of the people who will be marching here today, as we found out this morning, is the community.
All right, thanks very much for that, Masego Rahlaga. Just they're at the hospital in Vosloorus. Just staff and the community, like she says, largely going to be marching about the state of that hospital and the condition and what actually goes on there inside those walls. Well, as the